This video lecture was made by the Center for Future Dentistry under the SNUSD Knowledge Share Initiative with the support of the Korean Ministry of Trade, Industry, and Energy. Welcome back. Thanks for tuning in for Vanatomy. In this time, like in the past session, we will only deal with ligaments which come out of MK anatomy or is necessary to understand MK anatomy contents. Let's go. First, we are talking about the ligaments of hip region. Transverse acetabular ligaments. It bridges the acetabular notch and joins the two ends of the acetabular labrum, forming a complete ring. Ligament of head of femur. It has another name, such as ligamentum teres or round ligament of femur. It attaches the head of the femur, as known as the fovea capitis femoris, and acetabular notch. Iliofemoral ligament. It attaches from the anterior inferior iliac spine to the intertrochanteric crest of femur. Ischiofemoral ligament. It attaches from the posterior surface of the acetabular rim and labrum to the anterior aspect of femur. Pubofemoral ligament. It is attached above the obturator crest and the superior ramus of the pubis. Below, it blends with the capsule and with the deep surface of the vertical band of the iliofemoral ligament. Moving on to the knee region. In this region, we can see the lateral collateral ligament. It is attached from the lateral apicondyle of the femur to the head of the fibula. On the other hand, medial collateral ligament is attached from the medial apicondyle of the femur to the medial condyle of the tibia and medial surface of its body. Patella ligament. It is attached from the patella apex to the tibial tuberosity. Popliteofibular ligament. It has two attachments. At proximal, it encompasses the musculotendinous junction of the popliteus muscle. At distal, the anteromedial downslope, the tip, and the posteromedial aspect of the fibula styloid process is the site of attachment. Oblique popliteal ligament. It is attached from the adductor tubercle of the medial side of the femur, the upper margin of the intercondylar fossa, and the posterior surface of the femur, to the posterior margin of the head of the tibia. Arcuate popliteal ligament. It is attached from the posterior portion of the head of the fibula to the intercondylar area of tibia and the lateral apicondyle of the femur. Anterior cruciate ligament. It is attached from the anteromedial aspect of the intercondylar area on the tibial plateau to the posteromedial aspect of the lateral femoral condyle. Posterior cruciate ligament. It is attached from the lateral surface of the medial femoral condyle to the posterior lateral intercondylar surface of the tibial plateau. Medial meniscus. It is attached to the medial condyle of the femur and the medial condyle of the tibia. Lateral meniscus. It is attached to the anterior to the intercondylar eminence and posterior to the lateral tibial spine. Posterior meniscofemoral ligament. It attaches from the posterior area of the lateral meniscus to the medial condyle of the femur. Transverse ligament. Transverse ligament of the knee is another name of this ligament. It is attached from the anterior convex margin of the lateral meniscus to the anterior end of the medial meniscus. Anterior ligament of the fibula head. It is attached from the front of the head of the fibula to the front of the lateral condyle of the tibia. Posterior ligament of fibula head. It is attached from the back of the head of the fibula to the back of the lateral condyle of tibia. Let's continue with the ankle revision. Anterior tibiofibular ligament. It attached between the adjacent margins of the tibia and fibula. Posterior tibiofibular ligament. It is attached from the posterolateral Volkmann tubercle to the small posterior fibula tubercle. Anterior talofibular ligament. It is attached from the anterior margin of the fibula malleolus to the talus in front of its lateral articular facet. Posterior talofibular ligament. It attaches from the malleolar fossa of the lateral malleolus of the fibula to the lateral tubercle of the posterior surface of the talus. Calcaneofibular ligament. It is attached from the tip of the lateral malleolus of fibula to a tubercle on a lateral surface of calcaneus. Anterior talofibular ligament and posterior talofibular ligament and calcaneofibular ligament are called in group as a lateral collateral ligament of the ankle joint. It attaches from the medial tibial malleolus to the anterior part of talus. Posterior tibiotalar ligament. It attaches from the medial tibial malleolus to the posterior part of talus. Tibiocalcaneal ligament. It is attached from the intercollicular groove of the medial tibial malleolus to the posterior part of the sustentaculum tali. Tibionavicular ligament. It is attached from the anterior colliculus of the medial tibial malleolus to the dorsomedial aspect of the navicular bone. Anterior tibiofibular ligament, posterior tibiofibular ligament, tibiocalcaneal ligament, and tibionavicular ligament are called in group as deltoid ligament or medial ligament of talocrural joint. Among them, anterior tibiofibular ligaments are classified as a deep fiber of deltoid ligament, and the remainder three ligaments are classified as superficial fibers. Let's move on to the foot region. Calcaneonavicular ligament. It connects the calcaneus to the navicula. Calcaneocuboidal ligament. It connects the calcaneus to the cuboid bone. Interosseous talocalcaneal ligament. It connects the talus to the calcaneus. Dorsal talonavicular ligament. It is attached from the dorsal aspect tala neck to the dorsal surface of the navicular bone. Lateral talocalcaneal ligament. It is attached from the lateral surface of the talus immediately beneath its fibular facet to the lateral surface of the calcaneus. Long plantar ligament. It is attached from the inferior or plantar aspect of the calcaneus to the cuboid and the second to fourth or fifth metatarsal bases. Short plantar ligament, or it can be called as a plantar calcaneo-cuboid ligament. It is attached from the distal inferomedial aspect of the anterior tubercle of the calcaneus, which is anterior to the origin of the long plantar ligament, and to the plantar aspect of the cuboid bone. Plantar calcaneo-navicular ligament. It can be called as a spring ligament. It is attached from the anterior margin of the sustentaculum tali of the calcaneus to the plantar surface of the navicula. Dorsal cuboideo-navicular ligament. Its attachment is the dorsal surface of the cuboid and navicular bone. Dorsal cuneo-navicular ligament. It is attached from the dorsal surface of the navicular bone to the dorsal surfaces of the three cuneiform bones. Dorsal cuneo-cuboid ligament. Its attachment at the dorsal surface of the cuboid and lateral surface of the cuneiform bones. Dorsal intercuneiform ligament. It is connecting the dorsal surfaces of the three cuneiform bones. Dorsal tarso-metatarsal ligament. It is attached from the tarsal bones to the metatarsals at the dorsal surface. Plantar tarso-metatarsal ligament. It is attached from the tarsal bones to the metatarsals at plantar surface. Among two tarso-metatarsal ligaments, the ligament that connects the medial cuneiform bone to the second metatarsal bone is called Lisfranc ligament. Plantar cuneo-navicular ligament. It is attached from the plantar surface of the navicular bone to the adjacent plantar surface of the three cuneiform bones. Plantar cuboideo-navicular ligament. Its attachment is at the plantar surfaces of cuboid and navicular bones. Plantar plates. Its attachments are metatarsophalangeal and interphalangeal joint of toes. Those are metatarsal ligaments. It attaches between the dorsal surface of the bases of the adjacent metatarsal bones. Medial talocalcaneal ligament. It is attached from the medial tubercle of the back of the talus to the back of the sustentaculum tali. Posterior talocalcaneal ligament. It is attached from the lateral tubercle of talus to the upper and medial part of the calcaneus. Plantar aponeurosis. It is attached from the tuberosity of calcaneus to the heads of the metatarsal bone. Dorsal calcaneo-cuboid ligament. It is attached from the distal dorsolateral surface of the anterior process of the calcaneus to the proximal lateral surface of the cuboid bone. Plantar metatarsal ligament. Its attachment at the plantar surface of the bases of the adjacent metatarsal bones. Collateral ligaments. It is attached from the depressions of each side of the metatarsal heads to the tubercles at the base of the proximal phalanges. Superficial transverse metatarsal ligament. It is composed of the distal transverse fibrous band of the plantar aponeurosis. The deep transverse metatarsal ligament. It attached to the heads of the all metatarsal bones. Superior extensor retinaculum. It is attached from the anterior aspect of the distal fibula to the anterior aspect of the distal fibula. Inferior extensor retinaculum. Its attachment at lateral aspect of the upper surface of the calcaneus, the medial malleolus, plantar aponeurosis. Flexor retinaculum. It is attached from the medial malleolus to the calcaneus. Superior fibular retinaculum. It is attached from the lateral malleolus to the lateral surface of the calcaneus. Inferior fibular retinaculum. It is a continuum of inferior extensor retinaculum to the lateral aspect of the calcaneus. This is the end of this video clip. Thanks for watching, and see you in next video.